Well, welcome back. It's our goal here on Balanced Health to give you tips that are quick, practical, and inexpensive that you can incorporate it into your lifestyle. And Joe has our healthy habit of the day. And the reason I explain, the reason BIT is in caps is because we can incorporate these in our lifestyle bit by bit. It's not painful. And it works.
And it's usually inexpensive.
It usually is.
Our healthy habit of the day is an extension of the apple a day theory. Shirley, this is going to be very quick. After 7 p.m., it's best to eat not at all or eat an apple, because with the apple with the skin on is really very filling. Another good thing to pick on is seeds. Pumpkin seeds, sunflower seeds. It kind of keeps you busy. You know, the pumpkin seeds, I like eating them because I don't even know if they really taste all that great. But you got to, pick it up and bite it and, spit it out. It makes me feel like a baseball player. It keeps me busy.
Well,
but not eating after 7 is so effective, or eating very little.
We want to after 7.
It's the American lifestyle. It's your payoff for the day. You've worked all day. You're stressed out. You're sitting there and you want to do this.
Well, I heard someone say, don't eat anything after 7 that doesn't have skin on it. And I don't think they were referring to your pets and children. So will any kind of fruit work, or is apples really better?
Apples are best because it's a fairly low sugar fruit, and there's just something about them that when you eat the skin, they're filling. I mean, I'm just seeing more and more articles on that. So, and it takes a while to eat it. I mean, really, you have to bite it, and that really has something to do with it. You could take a brownie and pop it in your mouth in 30 seconds, and there's 500 calories gone.
So, okay,
right?
Do you eat late at night? Well, now down to the real truth.
I used to always tell my patients about the royal diet. Eat breakfast like a king, lunch like a queen, and supper like a pauper.
There you go.
And there is something to that. An apple a day keeps the doctor away. So maybe the medical healthcare industry would say, don't eat apples. But Joe, it's healthy, highly healthy.
And another thing that I have to tell you that I love, because at night I get this thing where I want to eat something. I have a cup of herb tea with a little honey, and it satisfies my sweet tooth.
Well, and that's Shirley, whatever it takes, to do that. If that is good for you, if that works for you. So, well, I'd like to thank Dr. Walt Larimore for joining us. I do want to thank him for joining us, but we're not ready to go out yet, so I apologize. Doctor, we still have some more questions if you're willing to take some more questions here.
You bet.
Another thing that you talk about in your book is Saw Palmetto. There are some supplements that people are on the fence about. Does it work? Does it not work? And there are other supplements where it's just even the conventional and the alternative people agree. It works. And look in your book, I think there was 4 smiley faces for Saw Palmetto. So can you tell us what your research showed on that, and how does it work? Do you know how it actually works in the body too?
They don't know, Joe. How is it that the Saw Palmetto, some are substances in it actually shrink the prostate and improve prostate health? No one knows for sure. But a survey that was done just a couple of years ago of urologists showed that 64% of urologists use Saw Palmetto as their first choice when it comes to BPH, or benign prostatic hyperplasia. So that's one area where an alternative therapy has now become a standard therapy, and there's one drug company actually making a pharmaceutical product of Saw Palmetto substances.
Well, I have to tell you, my husband had prostate cancer last year, and the cancer treatment center where he got his treatment, they highly recommended Saw Palmetto, and Kylie, by the way, has a very good product with Saw Palmetto. But yeah, I mean, this doctor prescribed the Saw Palmetto for his prostate.
I think where we used to have conventional medicine and alternative medicine in opposition, now we're seeing more and more practitioners integrating the two into what is called integrative medicine. And there are a number of medical universities that now have departments of integrative medicine and who train physicians in integrative medicine. I think we're going to see more and more of that, where conventional medicine and alternative medicine are held to the standard of what works, not just what sells, but what promotes good, balanced health, which is really what you guys are all about.
And hopefully doctors will get more education on nutrition going through medical school, because right now it's kind of limited.
Yeah, exactly.
Well, Dr. Walter Larimore, thank you so much for being on the program. I'd like to thank Dr. Larimore again for joining us today. You can see Dr. Walt on Your Family's Health on the upcoming episodes of Balanced Health. For more info on Dr. Walt and his book, Alternative Medicine, check out www.tln.com and click on Balanced Health, or email us at balancedhealth@tln.com for a copy of the show, or to make a donation. Call 1-888-242-93...
888
888-242-9393. Thanks for joining us. We'll see you next time on Balanced Health.
God bless.